Your body is doing all this incredible work every single second that we just don't even think about. And maybe the most fundamental of all? Breathing. Seems easy, right? In, out. But it's this incredibly delicate balancing act. And when that balance gets tipped, well, that's when things get interesting.
Think about it for a second. We're always told how important it is to breathe in to get that oxygen. But what happens when you don't breathe out enough? It's a weird question, I know, but the answer is the key to understanding a really serious medical condition.
So here's what happens. You get a condition called respiratory acidosis. It's a fancy name, but all it really means is that your lungs aren't getting rid of all the carbon dioxide they're supposed to. That CO2 starts to build up, and when it dissolves in your blood, it makes your blood dangerously acidic.
Okay, let's try an analogy. Picture your body as a busy factory. All the work it does creates exhaust fumes. That's the carbon dioxide. And your breathing? That's the factory's ventilation system, constantly pumping those fumes outside. Respiratory acidosis is what happens when that ventilation system breaks down.
On the left here, you can see how it's supposed to work. Everything's in balance. The amount of CO2 your body makes is perfectly matched by the amount you breathe out. Your blood pH stays nice and stable. But on the right, that balance is gone. You're making more CO2 than you can get rid of. And that's when the scales tip and your blood starts turning acidic. The medical term for this state is hypoventilation.
So what's this hypoventilation thing really? It's actually super simple. It just means you're not moving enough air. Maybe your breaths are too shallow, or you're just not breathing often enough. Either way, the result is the same. Those exhaust fumes are building up inside the factory.
Okay, so what could actually cause that? I mean, why would the body's most essential ventilation system just stop working correctly? Let's take a look at the usual suspects.
Generally, the problem comes from one of two places. First, it could be an issue with the control center, your brain. Something like a stroke or even certain medications or drugs can mess with the signals from your brain that are supposed to be telling you to breathe. Or second, the problem could be with the machinery itself, your lungs and airways. Things like COPD, asthma, or sleep apnea can physically block or restrict the airflow, literally trapping the CO2 inside.
All right, now this is where it gets absolutely fascinating. Your body's reaction to this whole mess is completely different depending on one thing: how fast it happens. We're talking about a tale of two very different timelines.
So if the acidosis is acute, meaning it hits you all of a sudden, the symptoms are severe and almost all neurologic. We're talking headache, confusion, serious drowsiness. That's because CO2 just zips right across the blood-brain barrier. But if it's chronic, something that develops slowly over months or years, like with COPD, the body has time to adapt. The symptoms are way more subtle. Memory loss, trouble sleeping, maybe even personality changes. It's the exact same problem, but it shows up with two totally different faces.
So how does the body pull off that adaptation? Well, this timeline tells a pretty amazing story. At hour 0, the lungs fail. CO2 levels shoot through the roof and the blood pH just plummets. But within a day, the body's backup system kicks in, the kidneys. They sense the high acid levels and they get to work. And then, over the next 3 to 5 days, they do something incredible. They start grabbing and holding on to a substance called bicarbonate, which acts like a sponge for acid. It's this amazing compensation that turns an acute crisis into a more stable, chronic condition. So if the body has this incredible backup plan, how do we, actually fix the original problem? How do doctors step in and restore that critical balance? Well, first, you have to know exactly what you're dealing with. Doctors use a test called an arterial blood gas, or an ABG. It's like taking a direct snapshot of your blood's chemistry, measuring the exact levels of CO2 and pH to see just how far off balance things really are.
Once they have those numbers, the plan of attack is pretty logical. The number one goal is to fix whatever was causing the hypoventilation in the first place. But right away, the priority is just to get the air moving again, to restore ventilation. That might mean using a non-invasive machine like a BiPAP, or in really serious cases, a ventilator.
But, and this is a huge but, there's a critical catch. If someone has had chronic acidosis for a long time, their brain has gotten used to those high CO2 levels. If you suddenly drop their CO2 back to normal too quickly, all that extra bicarbonate the kidneys made is still floating around. This causes a massive, and I mean massive, pH swing in the brain, which can lead to seizures. It's incredibly dangerous. You have to bring that balance back slowly. Which brings us to a really counterintuitive point. You'd think, right? Acid problem? Let's just give a base, like sodium bicarbonate, to cancel it out. Makes sense, but it's almost always the wrong thing to do. It can actually make the acidosis inside the brain even worse.
And that really gets us to the main takeaway here. The solution to respiratory acidosis isn't some chemical you can inject. It's a mechanical one. It's not about adding a chemical buffer. It's about fixing the broken ventilation system and then letting the body do what it's so good at, finding its own balance again.
It's just such a powerful reminder of this unbelievable, intricate machine we're all walking around in. Which kind of leaves you with a final thought. If breathing is just one of these systems, what other silent, crucial balancing acts is your body performing for you right this very second?